Thank
you, chairpersons. Thank you, organizers. And I think one of the most important introduction point for me is that I am a Baroda medical graduate. Now, we have had a very nice lunch, and now I'm going to talk about what is beyond lunch. With cancer growing day by day, a lot of people ask me, and I'm sure they are asking you also in your daily practice, as to why so many cases and what we can do to prevent cancer. And every such discussion stops at diet primarily, shu khao, shu na khao. Whereas in the modern medicine, there is a lot of research already done in last about 15-20 years, published, covering thousands of patients, lakhs of patients, as to what are the reasons for cancer. We don't know all the reasons, but we know many of them, and they are far beyond diet. So we will talk about those today. It's a very big topic, lifestyle, so I will not be able to cover every aspect, but important ones which we can convey, you can convey to your patients and families in practice as to what they can do, what is in their hand. Okay? So first, I think, everybody thinks of lifestyle as something when they are ready for lifestyle. Means after about 40, people have settled in their career, then they start thinking. But lifestyle starts before birth. Okay? We know some of these data that in utero CMV infection can lead to blood cancer. Certain myeloproliferative neoplasms, again the first mutation happens in utero. Early life exposure to infectious agents can lead to cancer development. Not related to cancer, but also known very well, is that the maternal obesity increases the risk of cardiovascular diseases in children. Okay? So lifestyle starts way before when we start actually thinking. The other is that adolescent exercise is associated with reduction in mortality from all causes, including cancer, in middle age. So because most of the cancers occur after middle age, people start thinking of cancer prevention only at that age. But you should know that the seeds of good health are, from before birth and in the young age also. A woman's risk of breast cancer is primarily determined by her lifestyle before the age of 30. Now, we start mammogram after the age of about 40 to 50. That is when the cancer actually starts showing up. But the risk is determined by your lifestyle way before that time. Okay? And this is probably true for many non-communicable diseases. So the point is to start early, younger the age for risk factor, bigger the impact, and same for preventive efforts. So when you are talking to the families that you take care of, you can tell them to take care of the children lifestyle and not wait for adulthood. This is based on several studies, as I said earlier. It would seem, at the end of the talk, it would seem like what I'm talking about is what our grandparents were already doing. So actually it is nothing complicated. After billions of dollars of research, we have figured out that our grandparents were very, very smart. That's the one-line message of the whole talk actually. Okay? MD Anderson Cancer Center, which is the largest cancer center in US and in world, they have this review article from September 2008. The title is Cancer is a Preventable Disease That Requires Major Lifestyle Changes. Okay? Very clear message. So it is not about lot of other things, but primarily lifestyle. And what we know about the cancer is that tobacco, of course, 30% of cases, alcohol about 5%, lifestyle is about 30%. What many people don't know is infections, not just human papilloma virus, but other also. The hygiene also is related to about 20% of cancers. Obesity, as of today in US, 40% of cancers are linked to obesity. That is a huge number, a fairly preventable issue. Okay? And of course, lifestyle is very closely linked to the obesity. Air pollution and others are smaller factors, and hereditary is about 5 to 10%. Most people are hung up on the idea that cancer is a genetic disease, so it has to come from the families, but that is only 5 to 10%. So rest is all acquired. Now, when we talk to families about good lifestyle, it is very hard for most people to follow it. That must be the experience of all the doctors, that you tell them good diet, good exercise, wake up early, do this, do that, follow that, but they cannot do that. Motivation doesn't come, or as we have seen many memes on the WhatsApp recently, that January 1st to 6th, there will be a lot of people going for walk, the New Year resolution. From 7th, everything will be normal, right? So how do we get that drive, motivation, to continue and implement good lifestyle? For that, you need good EQ, emotional quotient. The mental balance is very important. And I would strongly urge for every one of you, for your children, grandchildren, and the families that you take care of, to ensure that they focus on this part a lot, that maintaining a good mental health, a good emotional quotient. Because if that is there, then this knowledge or whatever they read, they will be able to implement. If that is not there, then in spite of knowing, they would continue to eat unhealthy diet. They would not be able to exercise. Even when they are gaining a lot of weight, they would not be able to control their diet. So what gets you to a happy state of mind, a good EQ? That is a very important question. And this is again research-based answer. Largest study from Harvard, known as Harvard Study of Adult Development, going on for 3 generations. In fact, just 2 days ago, Divya Bhaskar on the, I think, 1st January front page, they have quoted this study. This study is showing that the number one factor determining how long we live and how happy and functionally well is the relationships, the quality of our relationship, not the number of relationship that we have on Facebook or whatever WhatsApp, social media, but the true high quality relationships. And what they say is the feeling that you can count on that relationship is the main test of the quality of relationship. Okay? So this is a very, very important factor. And this is just one study, but I'm quoting, but there are several studies which are now showing that the social factors are equally or more important than the organic factors that we as doctors keep talking about, like cholesterol or blood pressure, etc. How the longevity is determined is based on the social factors also. So how that works, we don't know much, but there are theories that during our lifetime we have lot of stresses and injuries, and that body, how it handles, is determined by how happy, content, in good relationship we are. Okay? So that inflammation injury, now in cardiology, oncology, everywhere you would hear about inflammation. And that can be reduced by having good relationship. Loneliness, as per these studies, are the biggest killer in today's day and age. And this is again proper allopathic research we are talking about. Okay? So coming to the next point of hygiene. So dental hygiene is linked to not only oral cancer but esophagus, breast cancer, skin cancer also. And you may be aware that it is also related to the cardiovascular risks. Similarly, the ovary and uterus cancer related to the hygiene's microbiome in the genitalia, in private parts, if it is not healthy, then there is a higher risk of cancers. One important part in the practice is prescription of antibiotics. I think the pediatrics have improved a lot about not writing antibiotics, and I think there is more awareness among public also, but it is important to note that too much antibiotics have many unintended consequences. One of them is cancer. By changing the microbiome of the gut unnecessarily, frequently, you lead to formation of adenoma, which is a very well-known precursor of colon cancer. Okay? Then comes high-dose vitamins, because everybody thinks that if small amount of vitamin is good, then larger amount is better, and if I take this much vitamin, I'll become a superman or superwoman. Okay? So lot of high-dose vitamins are going around, and those are clearly shown to increase the risk of cancer in multiple studies. None of the studies have shown them to be beneficial for anything. Okay? Either the studies are showing neutral or risk to health. So please remember that if you or your patients are taking high dose vitamins regularly, advise them to take only the regular, the RDA, recommended daily allowance, not more than that. Then comes night shift. So night shift is now almost an everybody's lifestyle. So sleeping very late is especially in the children and young adults, and that has been linked to multiple cancers including breast, GI and lung cancers in women. Night shift work, a risk factor for breast cancer. There are many studies you can look up on the internet. So what is night shift definition by the Center for Disease Control USA? CDC is the primary health body of government of US. So when they quote something, it is not without lot of research. It is very authentic when they come out with that. So night shift definition for them is at least 3 hours of work between midnight and 5 a.m. Remember how many of our children are awake between this time? 3 times or more per week. Long-term shift, that is 10 or more years, who started very early age and continued very long. This is the story of many youngsters. This is a highly preventable lifestyle factor for several diseases. You can read on the CDC website the list of the NCDs that this night shift leads to. It practically covers 80% of our outpatient today. If you read that list, your 80% OPD is covered by that. How it does this lead to cancer, it is not very clear, but one of the theories is that melatonin is one hormone which is produced at night, primarily between 10 to 2 a.m., 10 p.m. to 2 a.m. That is why sleep early, wake up early. So it is not just sufficient to sleep from 12 to 8 hours, or 2 to 10, which many youngsters argue with us, that I am sleeping 8 hours, you told me. Okay, I slept at 2, I woke up at 10. That's what I'm doing every day. That's not sufficient, because 10 to 2 is when you are making the most of melatonin, and this hormone has been shown to prevent the tumor growth in many biological models. Okay? Next comes the sedentary behaviors. This is not a surprise, of course, but very focused studies showing that if you are watching 14 hours per week of television, then your risk of colorectal cancer is 70% higher than somebody who is not using that much television. And when these studies were initiated, we did not have the smartphones. So add to that, there is additional sedentary behavior. So these are things which are in our hand. The good news also coming from these studies is that people who don't have time or motivation to exercise every day, like this formal 45 minutes of exercise, sweating, increasing heart rate this much, for them also there is a good news, like people like me, that you can have only weekend activity, weekend sports, cycling, cleaning the house, walking, running, whatever you do, just Saturday, Sunday also is a fairly good protection. And similarly, other minor activity levels, 3 to 4 minutes of activity burst, like in the various day times. So going up the stairs, okay, not taking a lift, elevator, going up the stairs, or park your vehicle far away from the shopping place. Instead of, we all like to circle around and find the closest parking spot. Instead, go far and you walk, 3, 4 minutes. Many such activities, gardening, helping, family, so many little activities also provide very good protection. The formal 45-minute exercise protection is here, and what I mentioned is here. So it is not even all the way down. So the protection level is pretty good. Okay. So this is a good news which you can also convey to your patients, that they don't have to be discouraged that if they are not able to wake up early in the morning and after 1st January to 6th January, if their drive has died down, don't worry. There are many other things you can do. Okay. Dry fruit consumption also reduces certain cancers, including colon cancer. Light to moderate drinking is linked to some cancers in women. And important point is that the risk for the women is double than the men. So if the risk for one drink for men is say 2%, for women it is 4%.
Sir, please, 2 minutes left.
So lastly, chemicals. A lot of people ask about this. Now, it is difficult to study all the chemicals, but what you can remember is that there are many chemicals around us which we cannot, replace everything, but avoiding packaged foods is most important. These are known to be a very important risk factor for cancer and obesity and many NCDs. Cosmetics also have at least 10 level 1 carcinogens. So last slide, lifestyle take home messages. As my elder uncle used to say, one line lifestyle, पैर को रखो गरम, पेट को रखो नरम, सिर को रखो ठंडा. This includes everything. So this is what I do in my busy practice when people ask me about lifestyle, because I don't have time to explain all these slides. Focus on children to encourage healthy habits. Be socially close. Reduce your screen time and increase your people time. A little bit of spirituality, I think, is important to improve our EQ. Sleep early, wake up early. Stay physically active even if it is no formal exercise. Diet we haven't covered, but in one line it should be as far as possible home cooked, hygienic, reduce packaged foods, eat early and less fried food. Maintain a daily routine. This is very important because our biological clock, many hormones are connected to our daily routine. So when we change the routine too frequently, the system gets disturbed. Personal hygiene and weight control. Thank you.